This episode of MMA Nuts is brought to you by GoDaddy.com. Use coupon code GO35OFF8 to get 35% off your total order. Defense soap. Offense wins matches, and defense keeps you on the mat. Visit MMANUTS.com/deals for our exclusive offers and coupon codes.
Hey fans, this is MMA Nuts, episode 147.
147.
My name is Ingo Weigold.
I'm Matt Griffith. This is MMA Show by my fans, for my fans, where we walk the line between serious and ridiculous.
That is correct. And speaking of ridiculous, we have with us today our first ever guest live via Skype.
Are you saying he's ridiculous? What are you saying?
Possibly. He's also a very successful doctor, Dr. Craig Perlman. How are you, sir?
Thanks, guys.
What's going on?
Coming on to talk about TRT and MMA and all sorts of other good stuff. Can you kind of qualify yourself for the fans out there? What's your background?
All right, so I like to list my credentials as dual board certified in both internal medicine and endocrinology, diabetes, and metabolism. I graduated medical school about 5 years ago. I spent most of my life studying. And at this point, this is the pinnacle of my career, being on the show as well.
Of course.
Awesome. Awesome.
And I just want to elaborate that right now you guys are consuming performance-enhancing drugs at this point.
Alcohol?
Oh, yeah.
What type of performance? Like sexual performance or MMA performance?
It's just, in
Both.
front of the
In
camera
general?
performance.
Okay.
And myself,
Awesome.
I had coffee.
Okay, so that's good.
That's what I had. I always have one before every show. At least one, if not two.
So basically, you are a doctor who prescribes at times when needed testosterone and various other drugs for people who may or may not be deficient. Is that correct?
That is correct. Yeah. So what we deal with is not the same thing as therapeutic exemptions for testosterone replacement therapy in MMA fighters or other athletes for that matter. But we're talking about, the bread and butter, patients such as yourselves or myself.
Okay.
So Matt alluded to an interesting story a couple of weeks ago about low testosterone. It's not a HIPAA violation at this point, considering you already discussed it to the rest of the world.
Yeah, I don't care.
But it was a fantastic story. I love the fact, that a female physician was palpating your testicles with the window open, and a family of 5 was walking out of the van.
Yes.
Woo!
And he took it in stride like a champ.
What are you going to do?
Cheers to you, sir.
Thanks.
So.
However, the physician that you had, the endocrinologist, was very informative in describing some of the etiologies and the causes of low testosterone. So there are a number of MMA fighters that have a therapeutic exemption for testosterone replacement therapy. Dan Henderson, Chris Lieben, Chael Sonnen, Vitor Belfort, which we can get into later in more detail after. And I think there are a few more.
Chris Cyborg.
Yeah.
I don't know. Well, that's a question, too. Could women get one?
Yeah, could a woman...
That's blasphemy.
There's actually a lot of data in regards to testosterone replacement therapy in women for female hyposexuality syndrome. And that's the main etiology.
Hypo is the bad kind, right? That means no sex.
Oh, yeah. Hypo being low, not enough sexual desire.
Got it.
So
Hyper is the contrary.
Okay, nice.
Okay, so looking at those athletes that have attained therapeutic exemptions, I'm going to go out on a whim here. Maybe there is a medical diagnosis for low testosterone. However, most of these fighters do not appear in any way as though they're deficient in testosterone.
How so?
Well, how do you account, for instance, for Overeem, who recently tested for such a low testosterone?
Horse meat. Horse meat.
He said it was in the 100s, from what I recall. And isn't that considered low testosterone?
I may or may not agree with Matt on this one. For instance, when he tested positive, so what he tested positive for was about a year and a half ago, like more than a year after I'm sorry, more than a year before he tested with a very low total testosterone level of 189 nanograms per ml. He had tested positive for an elevated T to E ratio, which I'll mention exactly what that is. Testosterone to epitestosterone ratio, his level was 14:1. Now, technically, I have a lot of patients who have low testosterone because of previous either anabolic androgenic steroid use or testosterone use. What the treatment is lay off everything. Just lay off any performance enhancing agents whatsoever. It takes about a year. For him to test that low over a year after testing positive for the TDE ratio leads me to suspect that there must have been some abuse within that preceding year after having a low testosterone level.
Okay.
Now, what can cause a low level? It could be anabolic steroids or it could be synthetic testosterone. So when I see a low total testosterone level on a lab on that drug test, it's a red flag to me. It's not a flag. It's not. What doesn't pop into my head is, oh, poor Overeem. Look how low he is now. He's the
That's how I would view it. But
that poor
that's
man.
just me.
Look at how small
he
he
needs a
is.
therapeutic use exemption.
He's so tiny now. Yeah.
Yeah.
Shriveled
I don't
up.
think he was that much smaller. I
Well,
think
he
was
I
fighting-
thought he was.
He was fighting at 205, and then all of a sudden he's showing up. He's 265. Like,
Yeah.
how the fuck do you put on 60 pounds of muscle, or maybe it's
Horse
40
meat.
because he's cutting weight. But
He's
I mean,
shopping at Aldi.
especially when you're in your 30s.
Right.
It doesn't happen.
Yeah.
And maintain that weight too.
Right.
He's still a giant.
Yes.
Yeah.
And so cocky, and obviously so aggressive. He has all the telltale signs of a supra therapeutic dosage, meaning that the levels that he was on, I'm sorry, the steroid that he was ingesting, whichever it was, via oral, injectable, transdermal, whatever it was,
Suppositories.
was definitely in large amounts, I'm sure.
Okay.
So the red flag is that low level leads me to suspect that he may have been on something else at that point.
Okay.
That was lowering his
So
level.
Matt kind of alluded to age, and I'm just curious for like the difference between a guy in his 20s to a guy in his 30s to a guy in his 40s. Is it really that dramatic? Like, I'm 35 and I had mine tested recently. I sent you my results and you said, oh, that's perfectly normal. But when I go online and read about where it should be, they're talking about ranges of like 700, 800, and I'm at half that. But you said that could be normal for me. Can you kind of explain that a little bit?
I was a little jealous of your level, actually.
You were?
After I saw it.
Okay.
It was a fantastic level.
Fantastic.
See?
Then why am I so small? I'm not that.
Genetics.
Explain that.
I'm going to mention something, but did you notice that your cranium, your head is actually larger?
It's gigantic.
I don't know if that's ever been mentioned on a previous
Yeah,
show.
It has.
But I think
Oh, it has?
it's because mine is small.
I have a
so it
giant
makes
head.
his look large.
No, I've always in the giant head and the square jawline. Like when I went to a carnival with my current
Oh,
wife
Jesus
and had a
Christ.
picture drawn of me, the fucking guy drew like a tiny little cute picture of my wife, and there's me with a giant ass head. I'm like, I don't fucking look like that. He goes, yeah, you kind of do. I'm like, okay, I guess I do. But
Pretty much, you were like, why did you just paint a picture of a bobblehead?
exactly, that's what he drew me as. And what are you trying to say by that? Is that like
You can't be knocked out.
maybe?
You're like Mark Hunt,
Could be.
bitch.
Is that a sign of testosterone or what? What?
Yeah. Not
What are you saying?
testosterone, but it's a sign of Bigfoot Silva syndrome.
Yes.
Oh.
All right.
Which
You have a
I just
tumor
coined
now.
that term. It's actually it's called acromegaly, which is usually caused by a
Now I
growth
have a
hormone
disease.
secreting pituitary tumor.
Yeah.
Okay.
So we can check your GH and your IGF-1 level,
Jesus Christ.
and we'll know exactly
No,
if
I'm
you
gonna-
have it,
I'm
and then confirm it with
dying.
a glucose suppression test.
Okay.
We'll take it.
And that only goes anally, Ingo.
That's it.
That's the only way we can test it.
Okay. No, I mean, back to the question. Seriously, I think people don't understand like the levels, like in where should they be? I mean, is there some kind
What's
of
a normal
guideline?
range?
Yeah, what's
How's
normal?
So, for the viewers out there, if you're watching, if you go to a doctor and they actually draw off testosterone levels, and you get your levels, and they show they're within normal range, they give you a reference range to the right. It usually says between 300 and 1,000, roughly nanograms per milliliter. That is the reference range for the average 20-year-old male.
Okay.
All right. So when a 70-year-old patient comes to me and says, "Look where my levels are," they're on the low end of normal.
850.
I like to remind them that that's on the low end of normal for a 20-year-old gentleman.
Okay.
So in that case, you have to keep that in mind. The studies show that after the age of 40, the testosterone levels may drop by 1 to 2% per year.
Oh, that's going to be a problem. 'cause
Terrible.
I'm almost there.
Yeah.
We're going to need to get on the program.
That's 3 increments of nanograms per milliliter per year, which it tends to not be that much. It
Yeah.
does go down very slowly.
Okay.
That means the chance of these fighters over the age of 40 having a low testosterone is extremely low. So, and for some reason, it appears that a much higher percentage or proportion of UFC fighters over the age of 40 are on testosterone replacement therapy.
Okay.
Do I think they have male hypogonadism, the other term for low testosterone, due to age? Maybe 1, 0, maybe 0, none of them.
Mm-hmm.
The more likely etiologies, are previous anabolic steroid use it would be one possibility. The other ones are inherited congenital syndromes, Klinefelter syndrome. These fighters do not have Klinefelter syndrome. Klinefelter syndrome is a very common inherited genetic form of low testosterone with male gynecomastia. They have reduced muscle mass. It doesn't appear that way at all.
Okay.
Other causes are chronic opiate intake. What are opiates? Methadone, Vicodin, Oxycontin, Oxycodone.
Like painkillers.
Painkillers, yeah.
Yeah. And for the most part, there is a possibility there, considering what they go through. So chronic opiate intake would be a definite possibility for that to occur. However, who knows what exactly they're testing for in regards to not performance enhancement, but drugs of abuse. So I'm sure they're testing for opiate intake as well on these pre and post fight testing.
Yeah, I think they are. It depends on the state they're in. I think there's different tests they do.
You mean mentally or physically?
Right.
Yes.
Yes. Both.
Okay, great.
You mentioned earlier the T to E ratio, and I think there's a lot of confusion about that. I mean, for myself especially, you like Chael Sonnen had tested for some ridiculous ratio, yet I think the guideline, what is it, 4 to 1 or 8 to 1?
6 to 1, it depends, right?
Yeah.
Okay, so according to the International Olympic Committee and the WADA guidelines, it's 4 to 1. For the American Athletic Commissions, it's 6 to 1, meaning that it's harder to test positive in the UFC than in the Olympics and other organizations. So this is how it works. Testosterone is actually measured. Remember, most of these tests are in the urine. They're not in the blood. They're not in the saliva. They're in the urine. They're not in the hair follicle either. So testosterone, they're measuring testosterone glucuronide, which is a certain form of testosterone. Free testosterone alone is not tested. Epitestosterone, they don't test epitestosterone, they test epitestosterone glucuronide. I want to mention that because I'm going to explain how some fighters may be able to cheat, possibly.
Okay, it's a great question.
Or avoid that. Testosterone is a measure of not only your endogenous levels, but your exogenous levels. What does exogenous mean? That means testosterone taken in from outside the body.
Okay.
Endogenous means what you're producing yourself. Now, epitestosterone has no biologic activity whatsoever. It's an isomer of testosterone. However, it's of great utilization when it comes to drug testing. Epitestosterone is only produced by your body and it's not taken in. So it's a ratio. You're measuring something that's endogenous versus exogenous. And the higher the ratio, the more that you're taking testosterone in from outside. That's the simplest forms. Ovarian, 14 to 1 ratio. Sonnen, 16 to 1 ratio. Palhares, I'm not sure his ratio exactly, tested over also. Not sure exactly, but that's the history of elevated T to E ratios in the UFC. So let's say your ratio is last one. I'm sorry, I didn't mention LeVar Johnson, the most recent,
most recently,
last week. Okay, LeVar Johnson it's the saddest and most unfortunate situation because his ratio was 6.6 to 1.
Oh, just barely.
Made
It's too bad we're not in fucking Canada. That
Yeah.
0.6 wouldn't have mattered then, right?
That's right.
If he was in Quebec, they would have, they would have just taken,
round down.
Yeah,
Fuck it, you're
it's all
good.
Yeah.
You're good. It
It's
doesn't
under
matter.
7.
Yeah.
You're good.
So 6.6. So the unfortunate thing is that because he was above 6 to 1, they automatically do a reflex test.
What's
Now
that?
That's the qualitative test.
Blood?
That's the carbon isotope ratio test, also known as the isotope ratio mass spectrometry test. And that test is the expensive, more effective test that will tell you if you ingested any testosterone from the outside whatsoever.
Gotcha.
Victor Conte's argument, which is obviously the most plausible, is why are you even checking that? Just check the carbon isotope ratio on everybody, then you'll know. But we wouldn't have some interesting stuff to add here
Exactly.
if they did just that.
Expensive. And plus, I don't think they really want to catch guys who are skirting the line necessarily,
Well, like percentage-wise, like personally, I think the percentage of UFC fighters on some sort of performance-enhancing drug, I think it's in the high 80s. Like, do you have an educated guess as to what you think?
I would know if I knew who were in their camps. If you have one biochemist in any of those camps, then automatically it's going to be 100% for that camp.
Okay.
The physicians, like us endocrinologists,
okay. Yeah.
us endocrinologists, we're kind of like the retards of this area, not to defame us. We administer, we practice it, but the true geniuses and the masterminds of this are the biochemists, the pharmacologists, and the biochemists. So if you have if you can find out there's a biochemist in any of these camps, you know that it's on, and they're going to be intelligent and knowledgeable enough to avoid any detection at that point. Okay, so going back to LeVar Johnson, he tested positive on the qualitative testosterone test, and then he was ultimately his contract. He was
let go.
He was let go at that point. Yeah.
Seems like they have a very low tolerance, whether that's artificial or real. I mean, for anybody who kind of doesn't fall within the guidelines. Now, that kind of leads me to this question, because you mentioned Victor Conte, and he said that drug testing in sports these days is not so much a test of are you doing it? It's more like an IQ test, because these guys know they're getting tested. They know when they're getting tested. So how does a guy who knows potentially he may be tested, how does he fool the system, I guess? And because you say the odds are high, a lot of guys are saying 70, 80%, 90% of guys are doing it. How would one, kind of circumvent the testing system they have in place?
A big black cock with fake urine.
There you go.
Coming straight out of it.
Yeah.
Yeah. So one thing is the one thing I'm not going to use the word fortunate, but most of the anabolic androgenic steroids that are used, they're training drugs, meaning they're used, way in advance of these events, of their fights. So there's a long enough period of time to surpass that period of detectability. So if you look at the majority of fighters that have tested positive, they were utilizing agents that had periods of detectability up to 18 months. So Josh Barnett tested positive for nandrolone, which is decadurabolin. Period of detectability, 18 months.
Is that the gel?
Oof. No, injectable. So
okay.
This is a generalization, but mostly true. If you're on injectable steroids, the period of detectability is going to be much longer than oral steroids. So and there are oral and injectable versions of the same drugs, such as Winstrol and stanozolol, such as and the assumption is that if the fighters, or their camps, I would really base them on their camps. If their camps are smart enough, they're going to utilize the agents that have a short period of detectability, such as the oral agents. There's an oral version of Winstrol. a lot of the fighters did test positive for stanozolol, winstrol. I don't know which one they were using, the longer acting or the shorter acting. Same for Masteron. Masteron is drostanolone. Drostanolone was what the drug that King Mo tested positive for.
Okay.
Was he using the propionate version or the enanthate version? The propionate has a period of detectability of 3 weeks. The enanthate version has a period of detectability of 3 months. So it depends on that period of detectability.
I see.
I mean, I'm not. One thing to consider is when I see a fighter saying they're not ready to fight, that week when Dan Henderson got hurt, my first thought was, how come they can't?
Right.
I don't know. That's my first thought.
It's messing with their cycle, but what
or he maybe got a blood test done and it's like, fuck.
Yeah.
Something's I'm a little bit high right now. Like, remember Nate Marquardt?
Yeah.
He was like trying to get his levels down.
Trying to get him down. Couldn't get him down.
Just missed right before he got cut.
Now, the oral versions of these drugs are much more hard on your body. Is that right? Versus just injecting them, or?
Yeah, there's a higher amount of liver toxicity. And the reason that it causes liver toxicity is that there's something known as extensive first pass metabolism. That means that the liver is working extra hard to metabolize, to break down this steroid. And the fact that it's working so hard actually is toxic on the liver. And that's why the whole reason for health purposes, people tend to prefer the injectables as opposed to the orals.
And that's why you shouldn't drink while you're doing them, right?
Exactly.
Shouldn't drink.
Yeah.
But isn't there some way alcohol can actually help you in a drug test or for this type of thing?
Yeah, so alcohol can falsely raise the T to E ratio, or will actually raise the T to E ratio. And then you could claim, I guess, in the past, before they used the qualitative testosterone level, that I was drinking alcohol, and that's why my TDE ratio is elevated. However, in the UFC, they'll reflex to the qualitative test. So regardless, you're going to test positive if it's high. So in this setting, if you're dealing with an organization that won't be testing for the qualitative test, then you can get away with that. There was a famous sprinter, a U.S. sprinter in the 80s, who tested had an elevated TDE ratio, and at that time they weren't using the qualitative test. So he was able to steer clear of any loss by claiming that he was inebriated during the
nice. I ran drunk.
Yeah.
Yeah. Okay.
So do you think that like testosterone replacement therapy, is it safe for people or not safe? Like,
I mean, I'm going to go with the silly answer with, it's on an individual basis, If it also depends on the dose. The dosage is really a very important concern here. I mean, for instance, athletes and bodybuilders are going to be using supraphysiologic dosages. They're going to be using insanely high dosages. We're talking about, in my practice, we're talking physiologic. We're talking, if a patient is on testosterone cypionate or enanthate, it's 100 milligrams per week. Right? The studies have shown that to actually increase your musculature, to cause muscle hypertrophy, to improve muscle gains without working out, actually, you have to inject at least 500 milligrams. So
like 5 times the amount then?
Yeah.
Wow.
So am I going to say it's safe? Most likely, yes. But not for everyone. I avoid it in patients with coronary disease. I mean, there are people that will develop strokes, cerebral vascular accidents due to excessive levels of testosterone. Sudden death is not uncommon. In the Tour de France and the high top-tier cyclists, 27 cases of sudden death in a decade.
Wow.
And most of that's probably from erythropoietin, from
EPO,
which the UFC and the athletic commissions do not test for.
I heard, they don't test at all, do they?
Is that stuff good, bad? Like, what
it's
is it?
Really good for endurance. So in the later rounds, I think for fighting, it's probably amazing. It's unbelievable. Medical clearance does entail a complete blood count, though, which entails a hematocrit and a hemoglobin. So what EPO does is it raises those levels. You can raise them to such a high level, though, that it can cause sludging and cause a stroke or thrombosis, or clot in your leg, which can go to your lungs and cause death. But so what EPO is that it increases the number of red blood cells. What do those do? Red blood cells carry oxygen to all the areas of your body, especially your muscles, so you don't tire out nearly as fast. So aside from musculature, etc. I mean, in fighting, cardiovascular endurance is just so important.
Yeah. So
it is to their benefit. The test for EPO was developed in 2004. Before that, the cycling organizations couldn't test for it. So all they did was they said, okay, nobody's hematocrit over a certain level. So everybody was on EPO, and all the cyclists would bring their hematocrit to that level. Okay. If it was a little too high, they'd phlebotomize themselves a little bit right before the event or before their testing.
Okay, wow.
Yeah. But if for endurance wise, fantastic.
I see.
Testosterone. I'm sorry to cut you off.
No, go for it.
Testosterone and anabolic steroids, which anabolic steroids are just derivatives of testosterone. So it's all in and of its own testosterone. You take enough of that, though, and that's also going to raise your hemoglobin level as well. So testosterone itself, they say, doesn't improve your endurance, but it does.
I got another question for you, too. So one thing I've heard is some of the doctors said that if you go on testosterone replacement therapy, that you have to continue it for a lifetime. Is that true or false?
It's true. The reason is that when let's say, Matt, you start, let's say I give you Androgel, which is a topical.
I'm right on my balls.
Right on the balls.
It's funny that you mentioned that, though, because the original preparation was actually a patch that you'd place on your testicle.
Nice, see?
But they don't.
Preferably your taint. But
Okay.
It's all good.
Thankfully.
So
Yeah.
endocrinology is all about negative feedback, meaning that you take in something, it turns off your own production.
Ooh.
The same ways I give you a pill like a thyroid pill.
Yeah.
It's going to shut off your own thyroid gland's production of thyroid.
So it's like a lifetime commitment to whatever you're doing then.
Exactly. You're shutting off your own production. So anytime you stop, it's going to drop initially because your own machinery has to kick in. So that's why it's considered lifelong. However, there are some people that come to me, some men that come to me who had just many years of anabolic androgenic steroid abuse, and they're feeling like such crap. I may give them a temporary amount of testosterone, or sometimes we use other agents such as Clomid, which is a selective estrogen receptor modulator, or HCG even, though, to stimulate your own body's testosterone production temporarily.
So will it kickstart it again then in some people, or?
The downside, which they don't really mention this online, is that let's say I give you HCG or Clomid and you raise your levels. You're like, oh, I'm improving my own body's production. That increase in the level itself, though, will shut off your own production. So when you stop those meds, you may exhibit a nadir again as well.
Worse.
Oh. So how does a guy like Nate Marquardt, who says now he's no longer on TRT, how does he do it?
It's possible.
It is?
It's possible because what happens is that for men, not as much so women, for men though, our own testosterone machinery doesn't shut off permanently. Even after 10 years of use, it will kick back in. You just have to stop everything for a year. Just stay off it, and it will come back.
Okay.
That's the truth. The problem is that most people don't want to wait a year.
Yeah.
Obviously.
Especially if you're a fighter, how can you?
Yeah. It's incredibly long.
Yeah.
Here's the hot topic these days, as I'm sure you've seen in the news, is Fallon Fox, the transgender fighter. Do you feel like that a transgender woman or man or whatever you want to call such a person should be fighting females? It seems like they have an unfair advantage. Can you kind of explain from a physician perspective?
Yeah. Okay. So Fallon Fox was born as a man, became a woman.
Yep.
But the issue is that her bone mineral density is still that of a man. What's the bone mineral density? It's the density of her bones. I think mass equals force, right? So in general, on top of that, there's more actual force going on there compared to a female fighter. The other thing is that I don't do any in my own personal practice. There's no I don't deal with transgender, but it is a common practice amongst endocrinologists. However, they are given a preparation known as estrogen to help for conversion. Estrogen is what strengthens bones, both in male and female.
So then they're doubling up then on the bone density.
Yeah, that means her bone mineral density is probably more than it was before she became so. And so I feel, because the male bone mineral density is high because of testosterone, which aromatizes, which converts to estrogen. I think it's an unfair advantage. I think so. I'm definitely against it for that reason.
Okay.
Sure, and we had talked a little bit before about the baseball players, and is it worth it to be, on steroids or on testosterone? And you had some good stats. Like, can you talk about that?
Definitely. There's obviously a financial incentive with any athlete. These MMA fighters, the UFC fighters especially, the most important thing is they're trying to, they have, majority do have families or plan on having families. Their financial returns are going to be highest during these years, most likely. So there was an interesting stat from Major League Baseball which showed that if you did steroids in Major League Baseball and you didn't get caught, the average net increase in that ball player's lifetime earnings was $8.8 million.
So wow, fucking
ridiculous.
Sick.
More than yeah. Wow. Okay.
Now, what I found more interesting though was that if you did steroids as a Major League Baseball player and you got caught, all right, and you were penalized, suspensions, etc., you still on average netted $2.5 million more than if you never did steroids at all.
So basically, cheating pays. I mean,
I wouldn't say it's cheating though.
Well, we'll disagree on that one.
Enhancing.
Why
is that cheating?
Well, I don't know.
It's true because in all honesty, all three of us are performance enhancing right now.
Right.
Are you guys drinking alcohol because you know why? Like that one or two drinks,
it's delicious.
It calms you down, and in all honesty, at this time of night, you're focused now, right?
Mm-hmm.
I mean, you're more focused after 2 beers. I just drank 2 cups of coffee. Why? I'm more focused. I could speak more clearly, a little bit more eloquently. That sounded so effeminate.
It's all good.
It's okay. No problem. Matt does both. He drinks coffee and drinks alcohol together.
And like the Zevia and fucking with caffeine.
He's got his.
Yeah. Oh, nice.
And the rum. A little Captain
You guys brew your own beer?
No, I gotta go gluten free.
Yeah, that's a lot of work. I've thought about doing that, but man, that is a lot of work.
You have celiac disease?
Yeah.
Are you Irish?
Yeah, I am actually.
That's why there's a high percentage of celiac disease in the Irish. Did you know that?
Yes, I did.
Okay.
Oh, okay.
It's crazy though. I just spilled all over my lap, by the way.
It's all good. So
when he said that, that's awesome. I did that once, by the way. Should I diverge into a little story?
Go for it.
It was a bachelor party for myself, impromptu, and I didn't want one, and they forced me into one, and they took me to some strip club, and right as we got in, first drink of the night, I spilled all over my lap.
Nice.
From my waist to my knees is just piss wet. And what's a guy to do at that point?
Keep
Are
going.
you supposed to take lap dances?
Yes. Absolutely.
Fuck yeah.
Of course.
Fuck yeah. I'm just saying, if you're a champion, you got to be a champion. So anyway,
yeah.
Oliver. So I want to talk about the women again, and like, what are the effects of say Chris Cyborg? She tested positive for obviously steroids, which I don't think was a shock to anybody. But what are the effects of a woman ingesting steroids or testosterone? What does that physically do to their bodies?
It's worse than men.
Ooh.
It's worse.
Is it?
It's a lot worse.
Do they grow like a testicle or 3?
I mean, super therapeutic levels is potentially very bad in both genders, but in women though. So as I mentioned before, with men, you know, that there's really very rare to have testosterone or anabolic steroid induced infertility, because it's usually almost always reversible. In women, it's not though. You can have you know, ovarian atrophy, and they can be rendered infertile very easily, actually, with performance enhancement. So much worse. They get clitoromegaly.
Ooh,
You know,
that means their dick will be bigger than
The
yours.
clits get large. Is that what you're saying? Enlargement.
There's something online.
Yes.
Uh-oh.
What should we Google search?
Here we go.
Tell us what should
Here
we
we
look
go.
for.
It's China.
China. Okay.
China.
Oh.
Oh,
The
yeah.
wrestler, right?
Yeah. Okay.
Yeah, just Google that, and you'll see me at age 5.
China clitoris.
Oh,
okay. Nice.
I'll have to
The
pull
big
that up.
penis. Okay. Nice.
But the other question to reiterate, though, is well, you know, if the female genitalia enlarges, does the male genitalia enlarge then? With it, it doesn't actually. Yeah. In
Damn
that
it.
situation.
We always get the
Shrink.
shaft. in
Balls
that.
shrink, right?
Balls shrink, penis stays the same size.
That's good.
That's
You don't need balls. That's just like ornaments on the tree.
Yes.
Overrated.
Yeah.
So when the endocrinologist was palpating your testicles, Matt, she was checking. What she ultimately was doing was attempting to get an idea of whether or not there was a history of previous testosterone intake or anabolic steroid intake.
She wasn't looking for some irregularities? Or is that what she was trying to trick me to just try to cop a feel?
That's an added bonus.
Okay.
The irregularities, you know. But mainly though, it's size. Actually, it's about size is the most important aspect of that exam. However, there was an MMA fighter. I think he was an amateur MMA fighter during a pre-fight physical. They found they picked up testicular cancer.
Oh
wow.
On pre-fight clearance. You know?
Oh yeah. I remember that. It was about a year and a half ago. Yeah, that's true.
Yeah, and I'm sure that was for the same reason, though, checking for previous anabolic steroid intake.
Gotcha.
But it's a great thing they were able to pick up simultaneously. That was great.
Yeah. Well, Doc, it's been awesome having you on. I'm sure we're going to have you on again soon. You've been writing a few articles for us. I think we'll kind of bring you. I think we'll bring you around as things kind of happen in MMA to kind of comment on some of the stuff. This is not the last we've heard of TRT, and I guarantee you there will be more, things that'll pop up as testing improves and whatnot.
I expect to see 17 needles on the background there.
Okay.
Because I don't know if you're a real endocrinologist unless I see some.
Yeah, he's got the scrubs on.
That's true. And he's
exactly
legit.
that.
What the fuck?
But the
What
truth
am I
is,
talking
though,
about?
one, I'm not a surgeon, and I'm going to bed, so this is just dramas.
Okay, very good.
Oh, good.
Nice. So thank you very much, and that has been this week's edition of MMA Nuts. My name is Ingo Weigel.
I'm Matt Griffin.
I'm Dr. Perlman.
Nice.
We will see you guys next time. Thanks,
He's
Doc.
Hector.
He's Hector. Hannibal Hector.
Hannibal Hector. It's
So,
all good.
thank you
All right.
much. Have a good night.
Thanks for playing.